Many persons with diabetes on insulin therapy, they really experience suboptimal outcomes, and they have these ongoing complications that can be traced back to inadequate injection technique and training. We need practical, updated, evidence-based recommendations that are so essential for primary care providers. And our diabetes specialists alike, they need to address those unmet needs when it comes to injection technique, education, and ultimately affecting those outcomes. I'm Dr. Eden Miller. I am a primary care provider, diabetologist, and a fellow in obesity medicine. I'm at my practice in Bend, Oregon, diabetes and obesity care. I'm really pleased that the Mayo Clinic Proceedings published this amazing compilation of several thought leaders, and we all got together, including myself, and we made what we hope to be this white paper related to the new standards of care in injection technique. So I'm happy to introduce Advanced Insulin Injection Technique and Education with Fitter Forward Expert Recommendations. And you can find that in the April 2025 Mayo Clinic Proceedings. The lead author was David Klonoff, MD, and many additional other contributing authors. So I want to give you a little bit of the overview of the findings we had in the Fitter Forward Committee. Insulin delivery technique education is neglected. In 2015, injection technique questionnaire called the ITQ was a survey of over 13,000 persons with diabetes from 42 countries. And about 40% of the respondents reported, less than that actually, that they received injection instructions from their healthcare professionals within that last 6 months. In this type of survey, we realized that the inadequate injection technique was pretty common. And multiple recent reports showed that persons with diabetes, at least on one insulin injection, they did multiple errors throughout their ongoing treatment intervention. These technical injection errors can lead to undesirable glycemic outcomes because the insulin doesn't get where it needs to be, because that's the mode of administration. We often see persons with diabetes can experience pain or complications such as lipodystrophy. Many of us don't even screen for lipodystrophy, and persons with diabetes who inject are pretty much creatures of habit. So we need to make it top of line that we're having these injection techniques conversation, reviewing that with the individuals and screening for these type of conditions that are from that inadequate techniques. So now we've discussed briefly how that injection technique and that review and education is needed for so many reasons, both on the person with diabetes side as well as the healthcare professional. So how is this going to relate to clinical practice? Well, the Forum for Injection Technique and Therapy Expert Recommendations, the FITTER group, was comprised of several physicians, including myself. We had nurses and diabetes educators and allied HCPs. They had previously created what we call the evidence-based resource, referred to herein as the FITTER when we talk about that. And it was for insulin delivery technique. We did it through workshops. They actually took that data that I mentioned previously from that questionnaire, and they amalgamated it into a very concise, comprehensive, data-driven review of the need, both with the healthcare providers in the world, as well as the persons with diabetes, that we need to address injection technique. We need to address some of the barriers related to this. As a result of that, our persons with diabetes are going to get those techniques. We're going to overcome that barriers of injection. We're going to overcome some of the complications relating to inadequate injections. We're going to provide an improvement in those therapeutic and glycemic outcomes and prevent some of those lipodystrophy that can occur when persons inject in the same spot. In addition, we're going to lessen pain, remove some of those fear-based barriers that often impact insulin administration, initiation, and titration. And we're going to overall improve the injection insulin experience for the person. So the next steps for this research is that education, bringing this Fitter Forward program as the new standards of care, by its publication through the Mayo Clinic Proceedings. I'm also going to be presenting upcoming workshops and lectures regarding this to remind us to bring it top of mind, because we know how we can improve the experience of insulin administration. We know how to provide that evidence-based technique to try to limit proactively those side effects and try to make that injection experience both improved for the person with diabetes as well as those HCPs that are guiding them through their journey of living life with diabetes. We hope that you'll check out this Fitter Forward recommendations. We're going to be including some patient-forward educational material, some resources for our healthcare providers. We want you to get in touch with those new ways to do injection techniques. So please check it out at the Mayo Clinic Proceedings April 2025 issue to find our advanced insulin injection technique and education with Fitter Forward expert recommendations.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com/Mayo Proceedings, or journal updates on Facebook, www.facebook.com/Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.